I wanted to start off by telling you that here at Banner Good Samaritan Poison and Drug Information Center, we get approximately 110,000 calls a year. And the great majority involve children under 5 years old. And we talked about some ways to avoid toxicity. Some of the stuff is on our website, and we're going to highlight some of that stuff today. I also think that the other group that gets toxic or has drug problems is the elderly. And we usually define the elderly as patients over 65 or so, and we usually talk about the ones that are taking many medications. A lot of the drugs that we test today aren't checked in the elderly. And when the FDA checks a drug and says it's safe in the elderly, they usually mean someone who's over 50 years old. And it's a little unfair because as you get older, there are certain physiological changes that occur. The protein levels in your body are changed, usually lower. The way your kidneys work usually changes, and you can't clear the drugs as adequately. And the chances for you to be on different medications are much higher. And the more medications you are on, the more likely you are to have a drug-drug interaction. There's many drug interactions out there. But if you were trying to summarize briefly what the most important ones are, or things to be curious about, or always inquire, and you're best at being your best advocate there. When you see a physician, try to have questions listed for them. But certain important drugs include drugs like warfarin or Coumadin, which has many drug interactions. If you have a cardiac history, a heart history, have had a heart attack, or on blood pressure medications, remember your blood pressure is well controlled. All of a sudden you go on a drug, another drug, and that could raise the level of that medication, and it could cause you to have a slow heart rate or low blood pressure. Those are very important. So cardiac drugs or heart drugs, drugs that are used to control your heart rate are very important. Blood thinners are very important. And it's not only things such as other medications, it's also such drugs that we get at an herbal shop that might cause a problem. There's many interactions that we see where patients go to health food stores and they get drugs such as St. John's wort. St. John's wort interacts with many drugs and they'll raise the levels of these drugs. I'm not totally discouraging this, but I'm telling you that if you do take it, a supplement, please bring it into your doctor and ask them about it. Also, as a plug for the Poison Center, at any time you can call us at 602-253-3334, 602-253-3334, which is the number of our Banner Good Samaritan Poison Drug and Information Center, and we can go through your medications, okay? I think that it is very important to do a medication checkup. When you go into the doctor, I think it's important for you to try to bring all your medications and just have them review it. I can tell you that at least once or twice a month we admit a patient to the intensive care unit because they have a slow heart rate or low blood pressure because they're taking a medication that lowers their blood pressure. Let's give an example. They're taking Procardia, and they have taken Procardia for their blood pressure. They went to another doctor and asked if he could refill his medication, and that doctor was kind enough to do that, and he refilled the medication, and it came up as nifedipine, which are the same drugs. One is the trademark, and one is the generic. Just be very careful of that. The other common thing that we see is somebody has an infection, and they go on an antibiotic, and they're on these drugs, things are going great. They might be on a drug like digoxin, or a drug for their heart, or Coumadin, and they go on this antibiotic even short term, and it causes a problem. I think that it's good to rely on the pharmacist to tell you about the drug interactions. It's good to go back to the same pharmacy. It's good to ask questions, but you also have to be your best advocate and try to bring those medications when you go to the doctor. Call the Poison Center. A good website to refer to is AZ Stop Falls, and what they do in this brown bag program is you'll see listings of places to go and to talk about it. There's many drugs that, for example, a diuretic will make you lose lots of water, and it can lead to dehydration, particularly as our temperature changes. There's other drugs that could affect your blood pressure by causing vasodilatation or your vessels becoming a little more dilated. And if you get up too quickly, it can cause dizziness or even passing out or syncope. and those are very important. Now, everyone falls into the trap of being on a medication and saying, look, I'm done with this medication and I want to save it. Or they have an infant, they're on an infant concentration and then saving it. We see many, many errors, many mistakes with these medications. If your medications are outdated and it's springtime now, I think spring cleaning should start in the medicine cabinet, and you should kind of go through and throw these medications away. In general, people recommend that you mix medications in general, especially narcotics, etc., because unfortunately there are people that go through these medications in your garbage, believe it or not. It's been reported, people have done this, is to try to mix it if you can with kitty litter or crush it if you can, but if you just dispose of them in the garbage, it's a good idea and recommended, out of people's reach and way. Also on the same website, you'll find a listing of how to dispose medications properly. You could also call the Poison Center and we will let you know that. In summary, I wanted to say that most poisonings, most accidental poisonings occur in the home. And just be careful of pool products, cleaning products, all of these things, especially that children can get into. Be careful when you transfer things out of one container to the other. It's generally not recommended. But if you do, please label it properly. Those are common mistakes that we see all the time. Also, with medications, realize that certain changes in your medication can increase the levels, and it can change your blood pressure, it can change your heart rate. Certain medications you might take to help you go to sleep at night, etc., might be changed by other medications. And just realize that those changes can make you more likely to fall. Okay, and just be careful of those things. Most of these can be found on our website, and please look at the website and refer to it. Please remember that every time you go visit the doctor, to try to bring all your medications, try to have them all written down, try to know the side effects of your medications. You can't believe everything you read on the internet, but it's a good place to start to review the medications.